Dr. Rogers, I just wanted to start with just a question about COVID for kids who are age 5 to 11. What are the risks for kids in that age group if they get COVID?
For the most part, the disease itself is going to be mild in most of those kids. And much like some of the adults, some of them may have it and not even know it. They could be completely asymptomatic. The challenge with kids is that one interesting thing about them is that their immune system is really strong. And part of what is so bad about COVID and also so unpredictable is when the inflammatory response to the virus starts to wreak havoc on the body. And because kids have such a robust immune response to things, one of the things that has been seen after some kids have had COVID has been what's called a multi-inflammatory syndrome, where multiple blood vessels in various parts of their body become inflamed. And it's similar to a disease that we've seen for years in pediatrics called Kawasaki's disease. And it's very serious and it makes kids very ill, more ill than the actual COVID virus itself does. It's a rare complication, but it is a complication that, while I have not personally seen it yet, some of my pediatric colleagues who practice in other areas have seen it and have seen how severely ill that kids can get on ventilators, requiring a lot of supportive care in the hospital, and probably with the potential for some long-term complications that are yet to be identified.
And, contrast that with the risk of the vaccine.
I think the biggest thing that I have heard from families and patients as I've talked to them about the vaccine, a lot of people ask me about the myocarditis piece. And while the myocarditis piece has been identified as a possible rare complication, it's extremely rare. It is one that has gotten a lot of people's attention. But the interesting thing is that COVID itself can cause myocarditis, and actually is much more likely to cause myocarditis in my patient population with kids than the vaccine is. And when I have spoken with pediatric cardiology colleagues because of patients that we co-manage, I've asked them specifically about their level of concern with respect to these patients getting the COVID vaccine. And they continue to say repeatedly that the benefits far, far, far outweigh the risks. And that's in kids who have known heart conditions. For kids who have healthy hearts, there's really not a major concern on the part of pediatric physicians administering this vaccine. It's just not significant enough to raise our level of concern. Any immunization can give you a local reaction where your arm is a little bit sore, you get a little bit of redness at the shot site. And in rare instances, there have been some cases of allergic reactions, but those are also extremely rare. And we can almost always predict when those are most likely to occur in kids who are known to be allergic type kids. So for the most part, the vaccine is very well tolerated. The other thing that I hear a lot of families have questions about is the unknown long-term side effects of this vaccine because it's new. The thing about vaccines and the way that their complications show up, because they're not given every day to the body like a pill or a medication or other injections are to treat diseases, the complications and side effects from vaccinations are usually going to be seen very shortly after they're received, within sometimes hours to a couple of weeks, at the most a month. So these discussions about the unknown long-term complications are just not, in the medical world, are just not conversations that make a lot of sense to us, because we recognize that the side effects of vaccines are very mild and very short, and show up very early on. And it's something that is being surveilled as this vaccine has been rolled out in adults and in teenagers, and will continue to be observed in this younger population. And the vaccine safety protocols have actually done a good job over the years, even in my career, of recognizing when a vaccine does have a problem and taking that vaccine out of play. So as a pediatrician and someone who deals with vaccines and has dealt with vaccines for my entire career, I don't have reservations or significant concerns about the mild side effects, if any, of this vaccine for this population.
Right. And and it seems like the vaccine, once it's given, and once it gets into your cell, and it never makes it into the nucleus, once it starts, helps your cells start making the spike proteins that your body can make antibodies against, the vaccine basically dissolves and goes away.
Right.
So
Yeah,
yeah.
nothing stays in the system for very long with this vaccine. The messenger RNA degrades very quickly. And even though RNA and DNA sound very similar and are somewhat related, they don't intersect with each other in that way. RNA just doesn't insert itself into DNA. So that's really not even a thing in cell biology. And the spike proteins that are actually produced in response to it, those degrade very quickly as well. So the only thing that sticks around in the body after getting this vaccine is memory. Our immune systems, particularly kids' immune systems, are capable of memorizing things. And whenever something else comes along that sparks that memory, that's where the vaccine does its job. And it's not because something sticks around in your body, it's your body doing all the work. The vaccine just triggers that process.
So it sounds like in summary that if a young child gets COVID, they may be asymptomatic, but the risk is a more severe illness like the multi-system inflammation that they can get, and that can be a very significant illness. Whereas the
Yes.
vaccine, the chance of a bad outcome such as myocarditis is low, but that's definitely more treatable than a systemic inflammation.
For sure. I mean, in the instances where myocarditis has developed after vaccination, they have been very mild and with supportive care resolve themselves with time and observation, and are actually somewhat predictable in that respect. Whereas the virus itself is so random and so unpredictable in the way that it strikes and has different impacts on different people. This is just a personal anecdote. I had COVID about a year ago. I had it around Thanksgiving of last year. And I've certainly been more ill with other infections and other things that I've had over my life. But a colleague of mine from medical school also contracted COVID, and his course did not go well, and he's now no longer with us. He passed away
Mm.
in the ICU. So it's so variable and so unpredictable. But these side effects from the vaccine if they occur at all, are very mild and very, very manageable.
And from a population standpoint, we want to get as many people vaccinated as possible to get that herd immunity. So even though the child may not be affected as much by COVID, but they can potentially spread it to someone who's more susceptible.
Yeah, kids are a part of our population as well. And the longer it takes us to get to that critical mass of 70+%, the longer this is just going to drag on with masks and quarantining and missed days of school and families having to come pick their kids up at school and get a doctor's note for them and for their kid to get back in school. It's just going to go on and on and on. So if we can get more and more of the population vaccinated, of which kids are a part of it, it will go a long way to getting us back to something resembling normal life again.
Anything else to add? Any other points you'd like to make about the vaccine with the kids?
I guess the one plea that I would sort of make to families as they consider doing the vaccine is to be aware that those of us who are in this field, in the medical field, particularly those of us in pediatrics, we do this and went into this career for a reason. We like to see kids be healthy. We like to see kids thrive and do well. And there's no way that any of us would actively participate in any sort of a political or conspiratorial process to use kids as a way to test things or to do untoward things. This is all about wanting the best for everyone, particularly for kids. So I guess maybe when families are dealing with this, try to separate us from some of those discussions, because we're just wanting to work with families and with our patients to keep them healthy and keep them well. And we're always willing to have a discussion with families. I've been talking to families about vaccines my whole career, and the reluctance about vaccines, whether it be the chickenpox vaccine, which was met with a lot of hesitancy early on, the HPV vaccine, which still is met with a lot of hesitancy. it's a discussion that we're always willing to have, and we can give families information. It's just hard to trump feelings with facts. I find so if families can kind of step away from their feelings a little bit and look at some of the facts and information. I think that would be helpful for all of us.
Yeah. All right. Well, thank you so much, Dr. Rogers, for your time and expertise and for
Sure.
your care in our community and for helping us spread the word. Thank you so much.
Well, we appreciate all that you and your team are doing because it does make a difference, and I know it's not always the most gratifying work, but it's important.
It is important. Thank you so much.